Hey everyone, good afternoon. It's Sophia Towns. I am the program coordinator for the Low Country Autism Foundation, and we are doing another edition of Community Conversations Facebook Live. And today we are going to be talking about a really important topic, and that is self-care. For caregivers. And this can really apply to anyone. Everyone needs to practice good self-care, but especially caregivers in the autism community. So we have a special guest today. We have Leslie Slimmons with us today. And she is a licensed clinical social worker, and she is going to lead our discussion on the importance of self-care and some great practices that can come along with that. So, Leslie, I am going to turn it over to you. And guys, if you have any questions, please post those in the comments and we will get those answered. Take it away.
Okay, great. So hi, Sophia, and hi, everyone. First, I just want to say how much I'm thankful to get this opportunity to be on here and just to spend some time talking through. I think these are really big topics. It's especially so important for those who are in the caregiver role. So I'm excited to be here and to be able to talk through it. Before I go kind of into the meat of the material I want to share, I first want to, make sure that it's okay if when you hear self-care, if you automatically go to this place of like, well, I have no time. I think that everyone kind of has their own ideas of what self-care means and how it's supposed to look. Like often we think like you go and get a massage and that's self-care. And though that can be a part of self-care, today I hope I can make it sound a little bit more easier and doable, so it's not so as overwhelming or far-fetched. Like that doesn't work for my life. To me today, the goal is like, how do we make it work for your life? Because it is so important. So let's kind of begin by addressing or kind of naming when we talk about self-care. The reason why we're talking about self-care is because families that are supporting those who have children or teens or adults with autism, I think are experiencing some unique issues and challenges. And so I just want to spend some time first kind of naming those things so then we can tie it into like how can self-care be nourishing through some of those experiences. So first and foremost, I also need to express that I am not a parent of someone who has a child with autism. And so I recognize that. Right. So I want to make sure that when I'm naming these things, I hope it doesn't come across as like assumptions, because whatever your experience is your own unique experience. My hope is just to normalize, because sometimes you're in it that you forget that like what is normal and what's not normal. And so my hope is to be able to name these things that maybe you will find like, oh my gosh, like I can relate to that, or no, like I totally don't relate to that. But these are just some common things that I've experienced in the therapeutic space, as well as I'll just add in like a little research that's out there too, and we'll kind of go from there. So currently in my private practice, I do meet with a lot of caregivers. So in the therapeutic space, there are some general themes that I have found to be within private practice. And then also I worked at a school for 6 years that was specializing in working with teens with autism. So in both of those resources, I would say one of the number one themes that always came up with families was the issue of finding support and resources. And so whether that be through other families or friends, or just being with people where you feel as though they're not judging you, that always tended to be a very big theme that families experience. So a lack of support and a lack of resources and understanding for what some of the challenges are. I think another common theme is the fear of the unknown. So whether that be from the first onset of the diagnosis or even into adulthood, the overall question of what will this mean for my child and what will this mean for my family? So that is another issue, is just the fear of the unknown. I do think another main area is fear of future. So, like the feeling of how will I support my child financially if they can't hold a job, and and then what are the resources, whether that be through the government. What will that just financially look like for the rest of, it's not even just once they graduate or if they don't graduate from school, even past that. And then also that fear of, um, I guess I'll name it as institutionalization, or just that fear of like if they need extra support or systems and they can't live with me. So whether it be residential or a higher level supportive care, what will that look like? And just the fear of like, can I trust that system to care well for my child or adult? So I want to name that because I think that that's a real issue and a stress that impacts caregivers. And then with all of this, I think it automatically goes into anxiety and depressive symptoms. So I think anxiety can often look like increasing a need of wanting to control something. And so the anxiety shows up in wanting to have control over something, because autism can feel so out of control. Really, it then can, then for I think a parent, then it goes into their other relationships, it goes into their jobs, it goes into their friendships, of feeling this need to be more controlling because they need control over something. So that plays out, I think, in anxiety. And then depressive symptoms is kind of the opposite. So it's that decrease of energy, and recognizing that maybe those overwhelming and paralyzing feelings are then leaving this like lack of motivation, or this lack of desire of wanting to do anything that requires extra energy besides just functioning day to day. Um, so I'll just throw in some like numbers, just because sometimes I think the numbers just kind of make it more um, understanding that it's not just you. So for instance, for anxiety, um, so this is overall, this is not just for caregivers. It is the most common mental illness. So it affects about 40 million adults in the US. Um, and then depression affects about 9 to 12% of the US population, with suicide being still the number 10 leading cause of death in the US. And 80% who suffer through depression receive no medical treatment or intervention. So a lot of people who are experiencing symptoms of depression often will try to keep it inside, or they won't seek help or support for that. Another issue for caregivers is understanding that the stress is integrated also through health concerns. So recognizing that as much as we're talking about some of the social, emotional, and mental effects, I'm such a believer that whatever we feel on the inside has to process through us some way. And so often that comes through some health concerns, whether that be, uh, impacting your sleep, impacting your nutrition and what you eat, exercise and movement, and then all of those go into some very physical and real symptoms. So I think just being aware that it does impact your health. And then one of the things that I did want to debunk, that I think sometimes it goes out there a lot, is that there is an increase in the divorce rate for parents who are caring for someone with autism, and that's actually false. So that's a good news. So there was like this old research that said it was like 80%, but what we realized is that the research was just looking at families with autism, and so new research has compared families with autism and families where there is no child with significant needs, and it's actually 64% rate of divorce with ASD and a 65% families without. And so there's no greater, right? It's actually 1% lower. And so yeah, so you can debunk that about the divorce, because that I think is also a fear, but maybe you can let go a little bit of that one. And really just honest, I think going back to like the communication is the most important in dealing with raising someone with autism, and that allowing each parent to be able to express their frustrations, and scheduling time where it's just the two of you, and you're not talking about your child with autism. I think it's really important. Let's see. I think that's mostly all I wanted to cover about the issues. I think, one other study that I wanted to point out that was done in 2019 is looking at that. There was a study that showed that parents of children with autism had more parenting stress than those with raising a child with Down syndrome or like Fragile X. And one of the main points of the study was that it showed that it was the unique combination of pervasive behavioral function and emotional problems, and not the core symptoms of ASD that create the high levels of parenting stress. So I do think it's important to just kind of name that again. I think that caregivers of those with autism are in this unique category of stress because of what they may experience with the symptoms that their child with autism is having. Yeah, are there any questions before I move on, or should I just keep going? What do you think, Sophia?
I think so, but definitely what you just said about caregivers, and we have a unique, our own, group, caregivers of those with autism. We are very unique. Our stressors are very unique because of those other symptoms that exist. And I know, just speaking for myself, my family, for those of you who don't know, I have 3 boys, and 2 of the 3 have moderate to severe autism. And both of those boys experience elopement. So sometimes they just want to run away. And it's not the cute little toddler thing where they just, take a few steps and look back and they're real cute. It's full throttle, they're out. And there's no, they don't understand that there are cars coming. They'll run out in the road, into traffic. So just definitely not a good situation, very unsafe. And so that causes myself and the rest of my family, we have this feeling like, I can feel the anxiety just talking about it. But we do have this constant feeling of being on high alert. Like, we are on high alert 24/7, 24 hours a day, 7 days a week. We have locks on our doors. We have cameras. It's pretty constant. And I think someone compared it to that of an air traffic controller, and even a soldier suffering from PTSD, that there's no break. There's no break from it. You are constant. You are on that high alert 24/7. And so I don't know if that really exists within the other communities of special needs. I could be wrong, but I don't think so. I think that is really unique to autism. So I definitely identify with that. It is just, it's a doozy. So I'm sure most of you, I'm sure a lot of you out there can identify with that. So definitely, again, guys, if you have any questions, please plug them into the comments and we'll get those answered for you. Go ahead.
Yeah. I just wanted to kind of tie that into, I think that's a great example of looking at like PTSD. So if we look at trauma, right? Trauma is something that impacts the nervous system. And so when someone experiences trauma, we often kind of tie it into this need to survive by going into this fight, flight, freeze, or fawn response. And I do think it is so relatable when you are having to care for someone where there's issues of elopement or crisis, right? If you are in constant, needing to always be looking for the possibility of danger, right? So you're always in this fight, flight, freeze, or fawn response. That is then, when that anxiety increases, right? That's why, again, it's so important to be able to work with your nervous system to help your nervous system learn how to calm down, right? Because if you're always on the go, then your system is going to need something to help cope with that, because that our systems were not made to always be on this go, go, go mentality. So yeah, I think that's such a great comparison of relating it to trauma and knowing how that, how like PTSD would affect someone is very similar to having that same kind of response system within your nervous system.
Right, right. I don't want to jump ahead, but I just kind of thought about, our nervous systems are not meant to be on this high alert. And how do we how do we bring ourselves down? How do we relax and cope? And I think there are a lot of caregivers out there that will reach for the glass of wine, the drink, maybe some drugs to help, or put a band-aid on it to help cope. And I mean, I'll definitely tell you, when it's a tough day, I'm definitely reaching for a glass of wine sometimes too. And then I see a pattern of, ooh, I did this a few times this week. That's not good. So I wonder what the studies are as far as alcoholism and drug addiction among caregivers of those with ASD. I wonder if there's an increase in rate.
Yeah, I'm not sure, but I would definitely be curious about that too. Yeah, and I think that understanding that addiction is often a means to cope, right? So addiction is a way for our nervous system to cope with something it's experiencing. So if we're using that as the definition, then absolutely would make a lot of sense that if your nervous system is needing something, it's going to go, you're going to go for what can help in that moment, even if you know it's not good for you.
Right, right.
Yeah.
Or grabbing the dozen donuts. I'll do that too. This is going to make me feel better. This is going to make me feel better. So anyway, go ahead. I just thought that would be an interesting point. I wonder if there are other moms that do the same thing.
Right. Yeah. And I think that I think transition us into self-care practices. So I think we kind of just answered it, like, why are self-care practices? Why are we talking about it today? Why is it so important? And that's exactly it, right? If our nervous system was not meant to always be in this like survivor mode, then we're going to need self-care practices to help balance it out, right? Because in our nervous system, we've got two. We've got the system that's like that survivor, fight, flight, freeze, or fawn response. But then we also have this rest and digest. And when we're in balance, we're able to kind of go back and forth. However, for those who are in, experiencing crisis on a regular basis, they're often in this survivor, and they don't get access as much to this rest and digest. So self-care practices are ways to help our nervous system access the rest and digest. So I tried to make this as practical as possible because, again, self-care is a really big topic. And I love talking about self-care and boundaries. Those are like my two things that I really love. So I'll just try to make this practical. So I created 5 steps. And again, I want to make this feasible because if it doesn't work for your life, then you're not going to do it. So I always start simple and small. And so step 1 would be just creating some time where you can sit down and make a formal commitment to yourself, or even a contract with yourself, and asking, what is something that you can come back to remind you of the importance of doing self-care practices that are nourishing for your soul. So I'll say that again. What is something you can come back to remind you of the importance of doing self-care practices that are nourishing? So like when it gets hard, what do you have to come back to that's going to remind you why this is important? So whether it's because you want to live a long life and you want to be as healthy as possible so you can be a support and resource for your child, like that could be the commitment. Sometimes numbers can be really powerful. So if you like write a number of like, this is, like the numbers that I gave. This is how many people struggle with anxiety. This is how many struggle with depression. And I want to be healthy, right? So whatever kind of works for you. So that's step one. Step two would be to reflect on who supports you in this process. So really building a team of supporters that you can share and lean on. Like, who do you trust? And it doesn't have to be a lot of people, right? It could just be your spouse or partner. It could be your parent. And then to also recognize that this isn't everyone. So you don't have to assume that everyone needs to be your supporter, right? So kind of just validating, like, who do you trust, who can really support you, and who's like a good friend or a good coworker, but they're kind of that. They don't need to be this. The third one then would be to reflect on the habits that support you the most. So I'll just name a few that maybe you do without even thinking. So whether that be rest, a nap or sleep at night, friendships, movement, nature. Write them down and then keep this list handy. So you could write on a Post-it or an index card, somewhere where you can kind of see it and have access to it, and carry this list of everything that you can think of that feels good. So maybe it's flowers or a new book, sitting still for 5 minutes, a night where you give yourself permission to be lazy. These could be things that cost money. So it could be like a massage or getting your nails done, that require cost, money and time, but it also could be simple things, right? That you have easy access to. And then whenever you need it, pull out this list. So, like, especially if you're frustrated or if you had a hard day, many of those things on the list will not speak to you. They will just not be things that you want. And so that's why it's important to be as thorough and have as many options as possible, so you can at least find one thing that you can do for yourself. And then number 4 is now reflect on the habits that don't support you very well. So those things that you go into autopilot. So Sophia kind of named some of those. So particularly when you are tired, hungry, lonely, or angry. So like whether that's negative relationships, gossip, alcohol, junk food, right? And I don't think it's necessary like to ditch all of those entirely and then kind of beat yourself up if you do choose to do those things, but just know that those things are costing you, and that being honest with yourself in recognizing that, asking yourself, like, are these things restorative to me or are they depleting? Yeah. And then the last step is step 5, which is reflect on what you would say to a dear friend who is caring for their child with autism. So how would you offer support? What kind of messages would you send? And write that all down. And then on a regular basis, pour what you wrote down into yourself. Yeah, for some reason, it's so much easier to like give advice to other people and to be like empathic and supportive. But sometimes a lot of us struggle with self-compassion. So having a list that you can then pour back into yourself. Because
I love that.
Yeah, often what we say to others is really what we need to hear for ourselves.
Definitely. That's amazing. I love that. That is incredible. We do that all the time, I think. I mean, I do that with work, but I also do it just because I'm an autism mama, and I always love meeting other fellow autism moms and dads. And yeah, I do tell myself, like, I'll preach self-care, and then I kind of have that little voice inside of me, like, hello, you need to practice what you're preaching a little bit. So definitely. That's amazing.
Yeah.
I like that.
Yeah. And that's so I hope these steps feel like doable, and remembering on that list, right? Small is better. Again, sometimes we think about these bigger things, but if you can't have access to it, then maybe, think about like having it on the list, but just recognizing like it's not something you're going to be able to do every day. but having things on there that are easy and accessible, like even, and think about like our sensory needs, right? Like even just rubbing your hands, like that can be really soothing, or giving your head a massage, or like the back of your ears or your neck or your feet. Your spouse could, you could massage each other's feet. Like all of that is accessible and it's soothing.
Yeah. Yeah. It's not like we can just, many of us can't just go grab a mani-pedi and a massage. And so, yeah, I love that. Simple and things that are accessible for everyone. That none of that really costs much money at all. Yeah, I love that. That's great. Yeah, definitely. Anything else? What do you think?
That's all I had, unless there's any questions or anything that I can further assist with. I'm definitely open to, yeah.
No, I think, I don't think we have any questions yet, but if we do, we can definitely, we can let it, we need to reach back out to you and get some answers. We can definitely do that, but definitely valuable tips for all of us, even if you're not a part of the ASD community. Just so valuable. Self-care is important, and especially with this past year, I think with COVID, just what a year 2020 was. But Leslie, thank you so much. And I hope, guys, I hope you'll join me in trying to practice better self-care. Hey, Faye. I hope you'll join me in trying to practice better self-care, because I know, speaking for myself, I want to live as long as I can so I can continue to provide support and resources for my boys with autism and follow them through adulthood. So I need to be better about that. So we're definitely going to have Leslie back to talk about some more important topics for us. But thank you so much for being here today, Leslie.
Yeah, of course. Thanks for having me.
Yeah, absolutely. Okay, guys, y'all take care, and we'll see you next month. All right. Bye-bye.
Take care. Bye.